Hi, I'm Dr. Chelsea Boykoff, a family medicine resident with the Choctaw Nation. My QI project is titled SCREEN, which stands for Screening Colonoscopy and Cologuard, Reinforced Through Effective Education and Nurture. Colorectal cancer is the second leading cause of cancer death in the U.S., yet Native American communities face disproportionately higher incidence and lower screening rates. In my personal patient panel, only 56.8% of eligible patients were up to date on colorectal cancer screening. To address this, I implemented behavioral economic interventions into every patient encounter starting in January 2025. Behavioral economic interventions are low cost, evidence based tools that harness the power of psychology to influence people's decisions. I use several BEI methods. The first is defaults and prompts. I offered screening as the standard, not the exception. Screening was discussed at every visit and removing any passive avoidance. Number two is framing effects. Instead of leading with fear, I emphasize that colorectal cancer is highly curable when caught early, shifting the message toward hope and action. Number three is simplification. I delivered consistent under 30-second explanations of colonoscopy to reduce perceived complexity. Cologuard was introduced as a non-invasive backup. Number four is personalization. I adjusted the conversation based on each patient's health literacy and readiness and asking questions in regards to why each person did not feel the need for screening. Number five is salience and reciprocity. So I had handouts by the ACG trifold brochures. This is a tangible resource that serves as a visual reminder and built a sense of partnership. So after implementation of these methods, my screening rates of my personal patient panel rose from 56.8% to 88.1%. This has surpassed both my target as well as national benchmarks. So this improvement occurred without really adding a large amount of time to clinic workflow. And thus, it proves that behavioral economic interventions can transform care through small, intentional changes. As an osteopathic physician, I truly believe that prevention requires more than data. It requires a personal connection. So this project aligns with osteopathic principles because I address the whole person, mind, body, and spirit, and I promote self-regulation through early detection and respecting the structure-function relationship by preserving the colon's health before it's ever compromised. So, what makes behavioral economics interventions so powerful is that they're universally applicable, whether it's cancer screening, chronic disease management, or other healthcare screenings. BEIs can and should be part of every outpatient visit. They can make more patient centered, more effective, and more equitable healthcare. Thank you for your time and for supporting approaches that blend evidence, empathy, and innovation.